Hi, I'm Karen Evans. I'm the stroke coordinator for Detroit Healthcare System. A stroke occurs when a blood vessel inside the brain is either blocked or ruptures, which causes a lack of oxygen to reach part of the brain. Stroke risk increases with age. Patients that have diabetes, high blood pressure, are overweight, inactive, smoking is a big risk factor for stroke, and high cholesterol. So what we teach patients is to use the acronym BFAST, which is balance, a sudden loss of balance or coordination, change in your vision, a sudden loss of vision, particularly in one side or the other. The F is for face, so we're looking for facial droop. You can ask the person to smile and show their teeth and see if their face is asymmetrical. Arms, we're looking for weakness, particularly on one side of the body, either in the arms or the legs. The S is for speech, and what we might see could be aphasia, which is the person may not be able to get out what they want to say, or it could be just confused speech, a mixture of words. And then finally, the T is time, and that is the time to get to the hospital, to get to help, because that is the most important issue with a stroke. If you suspect that someone is having a stroke, the most important thing to do is to get help right away. Get them to help right away, or if you have a telephone, call 911. You can report that you suspect that the person is having stroke-like symptoms. Let them know and get them the medical care that they need. Detroit Healthcare System is classified as a primary stroke center. We treat patients with acute stroke symptoms. We see them initially in the emergency room. They go directly to CAT scan. They have a CT scan, and immediately following that, they have an exam by a teleneurologist. And then from there, we receive recommendations as to their care. If the teleneurologist feels that it's appropriate for them to receive a thrombolytic, we can do that here. If they feel like that patient needs to be transferred to a higher level of care hospital, we do that. Or we admit the patient and we do the standard of care treatment for ischemic stroke. The main thing that we focus on when we're teaching patients are the risk factors and the symptoms to be aware of. And the fact that if someone's having a stroke, the most important thing is to get here quickly, because our options for treatment are so much better for patients that come in early.